My name is Yvonne Pettigrew, National Clinical Lead for Allied Health Professionals, working into the Clinical Division of the Informatics Directorate at the Department of Health. In that role, I take a lead for all things informatics on behalf of allied health professionals working across the country. I work into that role as a secondment on 1 day a week, and the rest of the week I work into a secondary tertiary care hospital in the West Midlands. So I have a unique opportunity to understand how to influence and hopefully change some things around policy because of the way that they impact into practice in the real world operationally. Now I know that we've got some timelines around the way that our clinical records will need to be able to retrieve information in a way that tracks a patient's progress across their whole journey between organisations and across health and social care. And at the moment our care records don't enable us to pull information out in a way that makes sense across those care providers. The only way that we can do that will mean that we have to actually code it. And a coded language that we're going to be using, called SNOMED CT, is a bit of an unknown territory to a lot of allied health professionals. So we've got a need to start to learn what does that mean, what does it mean to us, and how would we use it into our clinical records of the future. If we can start to learn about it now and get it to make sense to us, then by the time we get to 2015, it should become a core practice element that actually isn't frightening or scary, but it's something that we've got some control over. And iteratively, our clinical records will start to be coded in the background and will still make sense in terms of the practice that we want to be able to record around a patient. But the learning will take time, and we know that it takes time to change the way records are recorded and retrieved. So I suggest to you, if you don't understand what SNOMED CT is, that you need to find out where the learning materials are, how you access those, webinars or learning materials that are available on the web, and that we start to build up a capacity to be able to change our records iteratively so that we're in a better position in the future to be able to understand whether we've really made a difference. Thank you.